a global threat. Understanding the prevalence of skin cancer. Skin cancer is a serious health concern worldwide. It is the most common type of cancer, affecting millions each year. The good news is that skin cancer is highly treatable, especially when detected early. Understanding the prevalence of skin cancer is crucial for raising awareness and promoting prevention. Skin cancer rates have been steadily rising in recent decades. This increase is attributed to various factors, including increased sun exposure and tanning bed use. Certain populations are more susceptible to skin cancer, such as those with fair skin, a family history of the disease, or a weakened immune system. However, it's important to remember that skin cancer can affect anyone, regardless of skin color. While it's more common in lighter skin tones, people with darker skin can also develop skin cancer. Therefore, everyone needs to be aware of the risks and take necessary precautions to protect their skin. Unmasking the enemy types of skin cancer. Skin cancer manifests itself in different forms, each with its own characteristics and levels of severity. There are three main types of skin cancer: melanoma, basal cell carcinoma, and squamous cell carcinoma. Understanding the differences between these types is crucial for effective diagnosis and treatment. Melanoma is the most dangerous type of skin cancer. It develops in the melanocytes, the cells responsible for producing melanin, the pigment that gives our skin its color. Melanoma can spread rapidly to other parts of the body, making it potentially life-threatening. Basal cell carcinoma is the most common type of skin cancer. It originates in the basal cells, which are located in the deepest layer of the epidermis, the outer layer of skin. Basal cell carcinoma usually grows slowly and rarely spreads to other parts of the body. Squamous cell carcinoma is the second most common type of skin cancer. It arises from the squamous cells, which are flat, scale-like cells found in the epidermis. Squamous cell carcinoma can spread to other body parts if left untreated. Melanoma, the aggressive threat. Melanoma is considered the most dangerous type of skin cancer due to its ability to spread quickly to other parts of the body. Early detection is crucial for successful treatment of melanoma. Knowing the warning signs and regularly checking your skin can significantly increase your chances of catching it early. Melanoma often appears as a new, unusual-looking mole or a change in an existing mole. It can develop anywhere on the body, but is more common on the back, chest, legs, and face. Melanoma can also occur in areas not typically exposed to the sun, such as the palms of the hands, soles of the feet, and even under the nails. The ABCDE rule is a helpful guide for identifying potential signs of melanoma. Asymmetry. One half of the mole does not match the other half. Border. The edges of the mole are irregular, blurred, or notched. Color. The mole has different shades of brown, black, tan, red, white, or blue. Diameter. The mole is larger than 6 millimeters, about the size of a pencil eraser. Evolving. The mole has changed in size, shape, color, or elevation. Basal cell carcinoma, the common culprit. Basal cell carcinoma is the most common type of skin cancer, accounting for the majority of cases diagnosed each year. While it is less aggressive than melanoma, it's still important to be aware of its signs and seek prompt medical attention if you notice any suspicious lesions. Basal cell carcinoma typically appears as a pearly or waxy bump on sun-exposed areas of the skin, such as the face, ears, neck, scalp, and shoulders. It can also present as a flat, flesh-colored or brown lesion, often with a slightly raised, rolled border. Unlike melanoma, basal cell carcinoma rarely spreads to other parts of the body. However, if left untreated, it can grow large and invade surrounding tissues, leading to disfigurement. Therefore, early detection and treatment are essential to prevent complications. Section 5. Squamous cell carcinoma, the sun's mark. Squamous cell carcinoma is the second most common type of skin cancer, often arising in areas frequently exposed to the sun. While it's more aggressive than basal cell carcinoma, it's less likely to spread than melanoma. Understanding its characteristics can aid in early detection and treatment. Squamous cell carcinoma often appears as a red, scaly patch of skin that may crust or bleed. It can also present as a raised growth with a central depression or a sore that doesn't heal. Squamous cell carcinoma is more common in fair-skinned individuals and those with a history of excessive sun exposure. While squamous cell carcinoma is less likely to spread than melanoma, it can invade nearby tissues and, in some cases, spread to lymph nodes or other organs. Therefore, early detection and treatment are crucial for successful management. Section 6. Warning signs, recognizing skin cancer symptoms. Being aware of the warning signs of skin cancer is crucial for early detection and treatment. While the specific symptoms may vary depending on the type of skin cancer, some common red flags should never be ignored. One of the most important warning signs is a change in an existing mole or the appearance of a new suspicious mole. Pay close attention to any moles that exhibit asymmetry, irregular borders, color variations, a diameter larger than a pencil eraser, or any signs of evolution. Another red flag is the development of a new growth on the skin, especially if it's persistent, growing, or changing in appearance. This could be a pearly or waxy bump, a red scaly patch, a sore that doesn't heal, or a raised growth with a central depression. Any unusual changes in your skin, such as changes in texture, color, or sensation, should be evaluated by a dermatologist. This includes persistent itching, pain, bleeding, or oozing from a skin lesion. The ABCDEs of melanoma detection. The ABCDE rule helps remember melanoma warning signs. Regular skin checks can identify melanoma early. Asymmetry, one half doesn't match the other. Border edges are irregular or blurred. Color, multiple shades in one mole. Diameter larger than 6 millimeters. Evolving, changes in size, shape, or color. Section 8. Beyond the ABCDEs, other warning signs. While the ABCDE rule is a valuable tool for detecting melanoma, it's important to remember that not all skin cancers fit neatly into these categories. There are other warning signs to watch out for, and any unusual skin changes should be evaluated by a dermatologist. One such sign is a sore that doesn't heal or heals and returns. This could be a sign of basal cell carcinoma or squamous cell carcinoma. Pay attention to any sores that persist for more than a few weeks or show no signs of improvement. Another red flag is a spread of pigment from the border of a spot into surrounding skin. This is known as radial growth and can be a sign of melanoma. If you notice a mole that appears to be bleeding color into the surrounding skin, see a dermatologist promptly. Changes in skin texture, such as thickening, roughness, or the development of a new bump or nodule, should also be evaluated by a dermatologist. These changes could be benign, but they could also indicate skin cancer. Section 9. Early detection saves lives. Early detection is paramount when it comes to skin cancer. The earlier skin cancer is detected, the easier it is to treat, and the better the chances of a successful outcome. Regular skin checks and prompt medical attention can make a world of difference. When skin cancer is detected early, it's often still confined to the top layer of skin, making treatment less invasive and more effective. In many cases, early-stage skin cancer can be treated with a simple surgical excision, removing the cancerous cells and a small margin of surrounding healthy tissue. However, as skin cancer progresses, it can invade deeper layers of skin and spread to other parts of the body, making treatment more complex and challenging. Advanced skin cancer may require more extensive surgery, radiation therapy, chemotherapy, or a combination of treatments. Section 10. Your skin's best friend, regular checkups. Regular skin checks are crucial for early detection of skin cancer. Just like you schedule regular checkups with your doctor and dentist, it's important to make skin checks a part of your routine healthcare. You can perform skin self-exams at home once a month to look for any suspicious spots or changes in your skin. Use a mirror to examine your entire body, including your scalp, face, ears, neck, chest, back, arms, legs, hands, and feet. In addition to skin self-exams, it's recommended to have a professional skin exam by a dermatologist at least once a year, or more frequently if you have risk factors for skin cancer. A dermatologist can identify potential signs of skin cancer that you may miss during a self-exam. Protect yourself and spread awareness. Protect your skin from harmful UV rays to reduce your risk of skin cancer. Adopt sun-safe habits and spread awareness. Seek shade during peak sun hours. Wear protective clothing like hats, sunglasses, and long sleeves. Apply SPF 30+ sunscreen liberally and reapply every 2 hours. Use broad-spectrum sunscreen. Avoid tanning beds and sun lamps. Enjoy the sun safely by following these steps. Check your skin regularly and see a dermatologist for any changes. Let's protect ourselves and our loved ones from skin cancer.